Afternoon, beautiful people. I just wanted to come on here and just share how I'm doing. I did a session last night, so I'm feeling, usually the second day post my ketamine session, I feel a little bit sad, but today I'm doing pretty good. I did some career development and some struggles that I had in regards to the careers. I think in my mind I had that I could not be enough. I could not do it. I'm not smart enough. I do have a cognitive impairment. I do have post brain injuries and all of that stuff. And I think I let those roadblocks kind of determine what I could and couldn't do versus what I wanted to do. And I always knew in my heart that I wanted to help people, whether that's physically help them with my hands, help them by talking, help them by listening, help them, just being there compassionately. I also loved providing preventative care when I worked in a health clinic where I would administer push IVs and all of that. I loved hearing stories about the patients, what they were doing, how they were preventing, what the therapies they were using that helped them and whatnot. So I definitely know I want to do something where I care for people. I've got a couple careers that I am doing more discovery on. With anything, especially with honestly my husband only being the financial breadwinner right now, I have to really take into consideration what I would like to do because it is a huge step to go to school and take out a loan and go into debt. And, if that's something that I can do, that's wonderful. But I'd hate to get to the end of the road and realize it's something that I can't do because of a requirement or because of, who knows, experience or whatever. So I'm doing a lot of information research. I love to help people. Where I'm at right now is in schooling. I have a year and a half left that I can do in order to become a nurse. And obviously I'd have to study and take the exam at the end of all of this as well, and probably doing some externships or experience in the hospital first before I get my full certification. But that's kind of where I've been at. That's probably going to be the most financial bearing on me, is finishing school in a college or a university. I've also looked into, this is kind of controversial to some people, but I feel like it's the most important for my route of healing, was doing empowerment coaching or intimacy coaching or relationship coaching through people who might have traumas in their life. I know for me, I had to work through a lot of complexes sexually in order to get healing through myself and my marriage. I I'm so thankful I'm married to who I'm married to, because he is the most patient man, the kindest man, and I don't think a lot of men out there would be that patient with me, especially when I went through my severe struggles of not even feeling like I could even do that. And that's part of being a woman, and it's part of life. It's part of, God created sex to be such a beautiful thing, and in this world there's already so much shame around it already, but then you put in there abuse. So things that happened to me that were out of my control, that I did not ask for, but that was afflicted on me when I was a child, that I had to get through the confusions of all the sexualness and just realizing it was not my fault, all that healing, everything. But coming out on the other side of that and being fully empowered sexually, I feel like I have a lot to offer women who might have gone through a lot of abuse, have PTSD, are struggling with how to communicate their desires to their their person. I feel like I have so much information to offer in this category. Um, Obviously, relationships are work in progress, so there's not ever a perfect relationship, but knowing how to communicate, knowing how to love yourself, empowering you to be your best self, both physically, mentally, and sexually, is very, and spiritual for myself, is important. So, yeah, that's kind of what I've been dealing with, discovering what I want to do, what I want to be. If I did the nurse route, I would be employed by the hospital and would work for, the hospital that I would choose. So there's benefits and there's also disadvantages of that. If I did more of the empowerment coaching and relationship coaching, that after schooling, it takes about a year to do the full onset of the school, the training with what I already have in my credentials. I would only have to do a year to do this and then do some traveling for master classes. But at the end of that, it's more flexible for choosing your own hours. The hardest part of that would be developing my own business, developing my own clients, like bandwidth behind that, and that I'm gonna have to do some research into and see if that's something that I'd be willing or know how to do. Trying to put my face out there on YouTube here also, so people can understand me. And at the end of my journey, if I am doing the empowerment coaching or intimacy coaching, I would love to chat with some of you guys on here. If you guys would like to see me during my trial time when I'm learning, I would love to offer up any advice that I can and see you guys. I hope everybody is living a blessed day and have a wonderful weekend. I am looking forward to date night tonight. Grandma is taking the littles overnight, so that's always a blessing. A little bit of decompression time is so nice. But hope y'all have a good day. Peace.